Today I would like to talk to you about the most common problem among the youngsters today, infertility. What is most important is you should realize that 50% of couples conceive within 3 months after marriage. 75% conceive within 6 months of marriage, and 80 to 85% conceive by the end of 1 year. So if you wait patiently for a period of at least 1 year, 80 to 85% of the couple would have conceived. Hello, I am Dr.Usha Rani, gynecologist and obstetrician at Mehta Hospitals, Global Campus, Velappanchavadi, Chennai. I am also retired professor of obstetrics and gynecology, Institute of Obstetrics and Gynecology, Madras Medical College. Today I would like to talk to you about the most common problem among the youngsters today, infertility. When would you say that a couple is infertile? After 1 year of uninterrupted, unprotected intercourse, if the couple fail to conceive, then we would consider them as, we will put a diagnosis as primary infertility. There is no need to get anxious before this period. What is most important is you should realize that 50% of couples conceive within 3 months after marriage. 75% conceive within 6 months of marriage. And 80 to 85% conceive by the end of 1 year. So if you wait patiently for a period of at least 1 year, 80 to 85% of the couple would have conceived without any anxiety, without any need for any treatment, any investigations, and any pressure. So when should a couple get investigated? Obviously, I just told you, if they fall in the normal age group, that is in the reproductive age group, less than 30 and above 20, they can get investigated after 1 year. But supposing they are much younger, some of them get married at the age of say 16, 17, 18 and all, those patients can wait for a further period of time. And those who are close to 30 or above, they can get investigated much earlier, or when they are anxious. Once they get anxious about their not having a baby, then they can get investigated because of the age factor. Now there is no need for the couple to get anxious unnecessarily or get pressurized by their parents or in-laws. They can explain to them and first try not to get stressed about this issue. Then what are the main causes of infertility? One should understand that the problem can be either with the male partner or the female partner. The society has a tendency to dump the blame on the female partner. So there should be cooperation on both sides. So the male partner should also be willing to get investigated. So basically semen analysis has to be done for the male partner, and any additional investigations will be based on the semen analysis report, and after physical examination of the patient, any further investigations can be planned. Similarly, there is a basic test protocol which has to be followed for the some blood tests and one ultrasound, which is required for the ladies and the female patient, and based on those findings, any further workup can be planned. But the basic investigations is a must first. We don't have to go into a elaborate investigation in the first visit itself. The cause nowadays, if you want to look at why many couples land up at an infertility center, it is because of the lifestyle, stress, and the number of patients with the male factor problem is rising considerably probably because of the lifestyle. Stress, diet, lack of sleep, all these things contribute, and habits like alcohol, smoking, all these contribute to male factor problems. And among the women, the most common cause is unexplained infertility, but you also see a lot of cases of polycystic ovarian syndrome. This polycystic ovarian syndrome will interfere with the proper ovulation. So anyway, if somebody has polycystic ovaries, there's no concern, there's no need to be concerned about it. You can meet the gynecologist and take their advice, and it is possible to have babies even if the woman has polycystic ovaries. Other causes can be a pelvic infection and all other things, but this if you go for a counseling to the gynecologist, they will be able to clarify. What is most important about this? At the end of this episode, what the take-home message is: please don't get elaborate investigations in the beginning itself. That is number one. Number two, be patient. Nothing will happen overnight. If you have to see a result of one treatment, it takes at least one cycle, 1 month to know the result. It is not like taking tablets for fever or anything where you take a tablet and you see the result within a day or two. So patience is what is very important, and don't jump from one method of treatment to another method just because you haven't conceived the first time. So you have to have the patience, give enough time, and don't yield to pressure from relatives, and be very calm and stress free. This is very, very important. This is the take home message. Thank you.